Hello, my name is Amanii, and the drug that I chose to present on is ibuprofen. A little bit of background of ibuprofen. It was created by Stuart Adams and John Nicholson. They initially wanted to find a drug for rheumatoid arthritis, but however, they came up with ibuprofen. And ibuprofen was first marketed in the UK in 1969, in the US in 1974. Ibuprofen has been over-the-counter drug in the US since 1984. Drug name and classification. Ibuprofen is classified as a non-steroidal anti-inflammatory pain drug, an anti-inflammatory drug, and is used to treat mild to moderate pain. Ibuprofen can be used to treat fever, menstrual cramps, and other conditions. And some well-known brand names of ibuprofen are Advil, Motrin, Ataprin, and Myadol. Drug indications and contraindications. Drug indications are pain relief, basically reasons why they would take the drug, which would be pain relief, fever reduction, inflammation reduction, and dysmenorrhea, basically relief from menstrual cramps. And a contraindication indication would be allergies, and as well as severe liver disease and gastrointestinal issues, a history of gastro bleeding or perforation, and as well as someone whom is pregnant. Um, so it's recommended for them not to take it in the third trimester due to premature closure and ductus anteriosus in the fetus. Ibuprofen characteristics. The half-life of ibuprofen is approximately 2 to 4 hours in adults. The bioavailability is about 80 to 100 intake, just means that the drug is absorbed into the bloodstream when taken orally. Dose response. So ibuprofen is dose-dependent response is meeting to effective and potential and side effects increase the higher dosage. Typically, a dosage range from 200 milligrams to 800 milligrams per dose. Potency. Ibuprofen is considered a moderate potent NSAID, less potent than some prescriptions. And dosing forms come in various milligrams, which can be 200, 400, 600, and 800. Typically, you can find the dosage of 200 milligrams over the counter. Anything pretty much 600 or higher will have to be prescribed by a physician. Ibuprofen dosage guideline. For adults in need of pain relief, fever reduction is about 2 to 400 milligrams every 4 to 6 hours. And the daily dosage should not exceed 3,200 milligrams. And anti-inflammatory effect, higher dosage, 6 to 800 milligrams may be needed for anti-inflammatory effects taken 3 to 4 times daily. For children, it is recommended for 5 to 10 milligrams every 6 to 8 hours needed, and children have the maximum daily dose that should not exceed 40 milligrams or 2,400 milligrams. And here is the list of ibuprofen that can interact with several other medications, which is anticoagulants, other NSAIDs, corticosteroids, and lithium, and methotrexate. Ibuprofen dosing guideline. The side effects of ibuprofen include I'm sorry, not side effects. Yeah, side effects is gastrointestinal nausea, vomiting, dysphagia, abdominal pain, cardiovascular, which can increase heart attack or stroke, and as well as hypertension. As far as renal, it can reduce kidney function, increase the risk of bleeding, and hypersensitivity reactions may include rash and itching. The central nervous system it may affect the central nervous system by dizziness, headaches, or drowsiness. Pharmacodynamics of ibuprofen. Ibuprofen works by blocking the COX enzymes, specifically COX-1 and 2. These enzymes are crucial for making prostaglandins, which cause inflammation, pain, and fever. By inhibiting these enzymes, ibuprofen reduces prostaglandin production, which helps lower inflammation, pain, and fever. COX-1 is found in most tissues and produces prostaglandins that protect the stomach lining, help blood clot, and maintain kidney function. Pharmacokinetics of ibuprofen. Ibuprofen is widely absorbed from the gastrointestinal tract, with peak plasma concentrations occurring 1 to 2 hours after oral administration. Here are some current or recent research, recent conducted research, and recently one was done on marathon runners, where in the study showed 75% of ultra marathoners who took the painkiller ibuprofen while running very long distances doubled their risk of kidney injury. In this particular study, there was a certain number of runners that was given a placebo, and then there were actually runners who were giving the actual drug of ibuprofen. At the end of this research, 47% of the participants took ibuprofen and 53% took the placebo. Results showed that 39 of the 89 participants had an 18% higher rate of kidney injury among those who took the drug compared to those who didn't. And another research briefly was about uh, using the drug for muscle relaxation. And the result of that study, they said there were some positive effects in use. However, there was no clear indication that ibuprofen was used to positively had a positive effect on the muscles function and function damage. And ibuprofen, the effect of ibuprofen to prevent the normal decrease in muscle temperature during post-exercise recovery may potentially be indicative of a delay in the anti-inflammatory response. The regulation of ibuprofen. Ibuprofen is not considered a controlled substance. You can purchase ibuprofen over the counter, but like I said earlier, ibuprofen can be prescribed by doctors, and it's typically because of the higher dosage. And ibuprofen is not banned by the Olympic Committee or the NCAA. In comparison of ibuprofen and naproxen drug comparison, ibuprofen and naproxen are both effective for relieving pain. However, naproxen the drug tend to be a little bit more effective as far as relieving pain longer, rather other than ibuprofen. And ibuprofen is much more common because of the cost. Because naproxen has better properties or better lasting effects of relieving pain, it typically costs more than ibuprofen. And here is my reference page.